Why is breast cancer treatment now so individualized? Imagine walking into a doctor's office and hearing that your treatment plan is uniquely tailored just for you. That's the reality today because of major advances in understanding breast cancer at a very detailed level. Breast cancer is no longer seen as one single disease but as a collection of different subtypes, each with its own characteristics and responses to treatment. This shift is driven by the fact that each tumor can have different biological features, making personalized treatment essential. Doctors now classify breast cancers based on specific receptors found on tumor cells. These include estrogen receptors, progesterone receptors, and the HER2 protein. Knowing whether a tumor has these receptors helps determine the best treatment options. For example, if a tumor is hormone receptor positive, hormone therapies that block these receptors are often effective. If the tumor overexpresses the HER2 protein, targeted drugs that specifically block HER2 can be used. For tumors that lack all three receptors, called triple-negative breast cancers, treatment usually involves chemotherapy or newer immunotherapy options. Advances in genetic and molecular testing have made it possible to analyze a tumor in great detail. These tests look for genetic mutations, protein levels, and other biomarkers that reveal how aggressive the cancer might be and how it could respond to certain drugs. This information helps doctors predict the risk of recurrence and choose treatments that are most likely to work. For instance, genomic tests can help decide if a patient with early-stage breast cancer needs chemotherapy or if they can safely avoid it, reducing unnecessary side effects. New assays also measure the levels of specific proteins like HER2 and TROP2 in tumors. This guides the use of targeted therapies called antibody-drug conjugates, which deliver treatment directly to cancer cells. These tools prevent a one-size-fits-all approach, ensuring each patient gets the most effective treatment based on their tumor's unique profile. Personalized medicine isn't limited to treatment choices. It also involves prevention and monitoring. Risk assessment tools, sometimes enhanced by artificial intelligence, help identify women at higher risk for breast cancer. This allows for earlier and more targeted screening. Imaging techniques like contrast-enhanced mammography are being tailored to individual risk profiles, improving early detection. Research is ongoing into even more personalized approaches. Scientists are exploring personalized cancer vaccines for triple-negative breast cancer and strategies to prevent recurrence by targeting dormant cancer cells. Lifestyle factors such as diet and exercise are also being studied as part of a comprehensive, individualized care plan, especially for those with specific risk factors. It's important to remember that not all these personalized treatments are available everywhere yet, and some are still under investigation. Treatment decisions should always be made with a healthcare team, considering the latest scientific evidence, the patient's overall health, and personal preferences. In summary, breast cancer treatment has become so individualized because of our growing understanding of tumor biology, advances in genetic testing, and the development of targeted therapies. This approach helps ensure each person receives the most effective and least toxic treatment possible. As research continues, the hope is to refine these strategies further, leading to even better outcomes for patients. Always consult with your healthcare provider to find the best plan for your unique situation.